Hey guys, it's Casey with New Beauty Company Aesthetics doing a little Q&A. The question is, I'm 45 and genuinely want to look refreshed, but I work in a conservative professional environment where I'm terrified people will notice. What's the honest clinical threshold between filler that looks like you had a good night's sleep and filler that reads as cosmetic work to a trained eye? The question of detectability is fundamentally a volume and product selection question. Published research on facial aesthetic perception confirms that observers identify faces as treated most reliably when three visual cues are present: disproportionate mid-face volume relative to the lower face, unnatural convexity in the cheek zone projecting beyond the natural cheekbone, and visible demarcation between treated and untreated tissue zones. Below all three of these thresholds, observers consistently rate treated faces as more rested, healthier, or younger without attributing the change to cosmetic treatment, even among people who know the individual personally. This is the therapeutic target for the population you are describing. The specific clinical parameters that produce undetectable results: total filler volume at or below 1 ml per treatment session for a 45-year-old with moderate volume loss, product selection biased toward low to mid G' fillers that integrate with tissues rather than projecting away from it, placement depth consistently at the deep supraperiosteal or deep submuscular level to avoid surface palpability or visible contour, and incremental restoration across 2 or 3 sessions rather than a comprehensive correction in a single appointment. For your specific concern, a starting treatment of 0 to 0.5 to 1 ml of low G' mid-face filler placed deeply will restore subtle 3-dimensional contour without producing any of the visual markers associated with cosmetic intervention. At New Beauty Company Aesthetics, we use a protocol we call restorative minimum volume, targeting exactly the result you are describing, the version of your face that looks like you at your best, not a different person.